So I'll now be doing the suboccipital release, part of the myofascial release techniques. In order to do this technique, I'll begin by just cradling the patient's occiput. I'll be flexing my fingers so that my finger pads will be contacting the area just between the occiput and that first spinous process that we would feel at C2. From here, I let the weight of the patient's head relax into my hands, inserting anterior pressure with my finger pads to the suboccipital musculature. From here, I'll be just applying a gentle superior traction with my finger pads and fingers flexed until I meet that restrictive barrier. This is a direct technique. I'm just holding the tissues here at this place until I feel relaxation of the tissues, at which point I may be able to add a little bit more superior traction, engaging the restrictive barrier. My end point would be when I feel a sense of compliance, perhaps increased warmth. My finger pads might feel like they're able to sink more anteriorly into the patient's tissues upon completion of the technique. The retest is essentially that sense of compliance that I feel under my finger pads. However, I could also do the retest by just reassessing the somatic dysfunction that I found at the OA by translating from one side to the other, both in flexion and extension, to see if there was resolution of that somatic dysfunction.